How you doing, guys? This is Kento at Kamiyama Physical Therapy. Welcome to our channel here. We just finished this webinar called Yes, Work Stress is Literally Pain in the Butt webinar. This was a really cool webinar for us, especially myself and Danny Bourbano, who's been hosting these webinars weekly since the COVID-19 lockdown. We had a guest speaker. His name is Alex Rascovar. He is a psychotherapist in New York City who works with individuals that have difficult emotions or difficult relationships. And it was really cool. It's a very insightful webinar where we talk about how the mind body kind of works together on a clinical setting. So it was really insightful for us. It was very helpful for me. For those that are very interested in these kind of stuff, this is the webinar for you. So hope you enjoy. We'll see you soon. Hi, this is Kento at Kamiyama Physical Therapy. Welcome to our channel. Okay. All right. So hopefully everyone can hear me. Thank you for coming, guys. I am super excited about this webinar right now. Welcome to the Kamiyama Physical Therapy webinar series. Yes, we just started to put it that way. We've been doing webinars for 8 weeks now. It's kind of a miracle for me that we've been doing a webinar every week, once a week on Tuesday, 2 p.m. So for those that's been doing and kind of staying with us, it really means the world to us, myself and Danny. We kind of just did it on a whim, and we've been getting some great feedback, constructive criticism too, which we've been kind of adjusting a little bit every time. So hopefully we're doing a little bit better each time. But since we've been doing, it was just myself and Danny for a while, I'm like, it's time for a guest. It's time for a guest. And since myself and Danny we like to be more holistic. We like to not teach, but treat people as a whole. So for those that have never been treated with us or worked with us, we really do believe an individual is not just a body part, but really, a sum of body parts, not just body parts, but everything together that makes us who we are. So we really like to kind of work in interdisciplinary care. So I kind of talked to Alex, my friend and expert, a psychotherapist. Alex always correct me if I'm wrong. Alex Rascovar is his last name, not Rascover. Rascovar is the correct way to pronounce it.
Yeah, it's good.
And he's a psychotherapist in New York City, expert or specialized in dynamic relations theory, attachment theory, mindfulness. I'm sure there's a lot more things that he's really specialized in. He works really well with individuals with difficult emotions and relationships. And he's also a good friend of mine. We kind of hit it off very quickly when we started to work with each other, and he totally gets how the mind and body are related to each other or how it influences each other. So when we talk, we kind of really see how certain stressors may lead to a shoulder issue. And it might not just be because, you just lifted your shoulder like with a heavy weight. It could be because you tense the shoulder up when you literally has these like survival mechanisms where you kind of get protected when someone calls you a certain name. You're like, oh, I need to get tight.
Yeah.
So the webinar is called Yes, Work Stress is Literally a Pain in the Butt webinar, just to kind of be catchy and to know what mind and body connection is. So today's webinar is more Q&A. We're going to make it more dynamic and more free flowing. I have questions that I selfishly wrote down, which
selfish question.
I am very, it's a very selfish, exciting webinar for me. But for those that are interested in regards to it, so I'm going to I'm kind of guided. I'm going to guide through the webinar a little bit through the Q&A that I'm going to go for. But for some that have kind of questions they want to ask, feel free to put it in the chat. Or if you guys want to talk, just kind of unmute yourself after, I don't know, about 10, 15 minutes of Alex and I talking. And we'll go into further, deeper stories. So hopefully you guys enjoy. So a quick thing about me. My name is Kento, for those that are new that's coming in today. I am, we're the Kamiyama Physical Therapy team, and I love to treat the individual holistically. I like to read. I don't get to read as much nowadays with the kids, but I do love to read. And I do love enjoying kind of going deep into topics. I love spending time with my 2 kids and my wife. So I forgot.
You're winning right now. That's really good. We all want something like that.
Yes, someone, people that care about me very much and love to give constructive criticism to me that says, I forgot my wife like the last 3-4 times. So I'm making sure I put my wife in there. So wifey, I love you. Just so you know, this is publicly in YouTube now. And also, I'm just going to quickly introduce Danny. Danny's my partner in physical therapy in our team. He's a physical therapy assistant and also an acupuncturist in New York. He also does teaching in Seton Hall University. He's very good at anatomy and he's great with teaching. He loves fixing cars and spending time with his wife as well. So we're not forgetting the significant others this time. So just in public, I'm just letting everyone know.
Super important not to forget the others, man. Super important, especially now. Really important stuff.
Oh, true. This is a perfect question for all of us. And for those going through these virtual times, not virtual times where they're in pain, we are offering virtual discovery sessions still. So it's kind of like no strings attached. If you do kind of need help and need some people to kind of expertly kind of see what's going on with you and see if we're a good fit, you're more than welcome to contact us. But this is about Alex today, so let's get started. This is Alex. Alex, do you mind kind of introducing yourself and we'll kind of get started with the Q&A?
Yeah, not at all. I mean, so hi everyone. It's so good to see everyone here, and I see some familiar faces that I am huge fans of, which is also lovely for me. And it's a wonderful thing also to be talking to you all vis-a-vis Kento and Danny, because they're two individuals that are just very gifted as healers themselves. A little bit about me. So I am a therapist in New York City. I'm in private practice. I actually specialize with creative types as well as like sort of strained or difficult family relationships, which some of us might have a few of those, and that's okay. I was actually trained at a program through my graduate program, which was very relational. In fact, it was actually like the birthplace of dynamic psychotherapy starting to actually be used, social workers actually starting to use that with veterans that had come back from the front. So it was one of the first dynamic programs that existed, and they have since actually like held that tradition and continue to hold that tradition. As of now, relational theory is kind of the latest incarnation of dynamic psychotherapy at this point. So that's where a lot of my focus went as far as my theoretical orientation. I also am an avid mindfulness practitioner, have been for a very long time. I started, God, I want to say like 8 to 10 years ago. It's been a while. I don't even like remember because it's been like a daily practice for a long time. And I just found a lot of wisdom, a lot of relief, a lot of sense of well-being in that practice. And it pairs quite well with relational psychotherapy in my mind. And the one thing that I would say is a little different about me as a sort of in juxtaposition to like the sort of grand scheme relational or psychodynamic or psychoanalytic therapist is that the flavor of dynamic therapy that I practice is experiential. And that really looks like taking time to understand even sensations or somatic experiences and what's there. I'm a huge believer that the body and the mind are connected, that we do not heal the mind without healing the body, without having awareness of the body, and vice versa. I don't think that, this Cartesian view of I think, therefore I am, is incredibly outdated, and I find that the way in is through understanding sensation, and one better is understanding sensation in relationship to someone else, right? And that's huge. That's an important thing. So yeah, that's my website. If anyone's interested in reaching out or has any questions, or please, go feel free. I am currently, I do have a few openings right now. So if people or folks are interested in trying it out, I'm more than willing to have a conversation and discuss, go from there. So yeah. How's that for the intro? How was that? Pretty good?
That was, excuse me, you choked me up. That's why. It was that good. It was that good. So that's awesome, Alex. So let's get started. I'm going to unshare, and we're going to make it more of kind of like a Q&A roundup type of thing.
Yeah, sure.
So I'll kind of get started because the reason why I wanted to do this, it just kind of connect the things of, a lot of people know that the mind and body does work together. But, do you have any ideas or examples that you can give where, like,
Mm.
the mind does affect, or maybe clinical experiences that leads to, it's like, hey, this is affecting possibly your low back issues or shoulder issues.
Oh, yeah. I mean, for sure. I think that whenever we go through any sort of experience where we start to go through tension and we do not have the awareness that the tension is there, or we might even have the awareness that the tension is there, like we start holding ourselves. It's the same thing in physical therapy where you see folks end up guarding, they have an injury and so they end up guarding that injury, which actually ends up reinforcing the injury over and over and over again. Right. So it's the exact same situation. I mean, I have seen a number of folks that have they're not aware of what feelings are going on when they're actually happening and how that is affecting their physicality. Right. It's kind of uncanny actually. I mean, the quickest example I can give, one of the most benign examples I can give, is like even think of your daily commute. I know I'm going to take us out of the webinar moment to think about what life was like in a not so distant past. But when you were sitting there and commuting on the train and you say like someone was in your personal space or something and you felt sort of uncomfortable, and it's like, well, how did you know you were uncomfortable? What was happening? What was happening for you? What was the sensation? And a lot of times folks have no clue, none whatsoever. They can say, I was uncomfortable. And I was like, oh, great. Like what happened though? Like what was it like? And they don't know, and they don't know. And if they really slow down, what starts to come to light is actually I started like tensing everything. Like I could start feeling myself like tense, and I could start feeling all this tension in my body. And I was like, wow, so you must have been really uncomfortable then, and it's that thing of this discovery of, oh wait, my body was telling me something. I just was not awake, didn't fully understand what was happening, you know. I mean, I'll give you another example, which is more of a relational example, is um, for those of us that are partnered, it can be that process of, holding on to frustration for a long period of time and not feeling safe enough or okay enough, to express that frustration, and all of a sudden you start being completely different physically around your spouse. You have no idea, or your partner. You have no clue, and like there's a holding process. You're holding something very specifically. It's like I don't know why. Like I have this pain in my neck. Well, okay, and then all of a sudden I told my partner that like they did this thing and it's been really frustrating, and magically the pain seems to like at least have been started to be in process where it's working itself out. I mean, and if we think about it, even from if we want to think about it from like a purely physical standpoint, think about walking around in the wintertime, and when we get a little bit older and we start walking around in the wintertime and our body starts like clenching in some way, and then all of a sudden all of these injuries that were sort of older kind of like start coming out, like, oh, for some reason winter comes around, my left knee hurts, my lower back's tight, and my shoulders are tight. It's like, right, well, emotions work the same way. You walk around, you harbor frustration, and you don't like basically process it in a proactive way, in a constructive way, right? Because we don't want to like be like hugely hurtful or anything like that. But since we're not processing it in this constructive way, it's just like it will change your physicality. And if we think about it, even from like the earliest stages, this is the most normal thing in the world. I don't know whoever has seen a newborn baby, like a truly newborn baby. Truly newborn baby, when you actually hold them, right, they completely mush into you, right? Like their body becomes formed around how you're holding them in some way, right? And if we think about this as an extension of how relationships end up playing out, which is that the relationship has an effect not only on our emotions, but the emotions and our physical posture. You'll see it time and time again. It's just it's very, very common And I think the battle that has to be fought is this idea of, how do I come into awareness of that? Like, how do I come into contact with that? And what does it look like? You know, and that process is really, it is, you know, I don't want to get like overly heady and use the word like praxis, right? But like, it's like this, it's this kind of like ever evolving process that we go through. And the key to it is awareness. But the problem is that oftentimes the thing that we learn to get into awareness or get into those feelings or understand our relationships, what have you, oftentimes those things that we learned keep us from that process. So that, again, we have that guard. We start guarding, you know. It's like, well, the guard didn't help you work yourself out from it. The guard is actually reinforcing that pattern over and over and over again. Questions, thoughts, feelings?
Yeah, Alex, that's a great point. I was gonna go differently, but let's actually keep going with that because I like to do it that way anyway. So you just said about how, certain things in life we do, you kind of said like a gardening, which is probably what we needed to do at the time, right? So let's say for example, my father did something to me, and let's say I wanted an ice cream, and he said,
Sure.
ice cream's really bad for you,
Right.
eat vegetables. And I said, I want ice cream though. But he's like, if you don't do this, daddy's gonna be really mad. So like there's
Right.
this guarding mechanism there.
Right.
And for those moments you did that because you needed to survive that moment where you had to make sure you're connecting with your father and did it. So
Right.
let's but at that moment it was great, but oftentimes that happens like as a default as we grow older, right?
That's correct.
Any thoughts on that that could lead to
Oh,
more
absolutely.
issues?
If we really think about it, in a lot of ways, we live in, you know, I think personally, and this is my own side diatribe, and you know, people are more than welcome to sort of, you know, disagree. I would be interested in hearing counterpoints if people are having them. But you know, I believe that we really do function in an affect phobic society, right? You know, we're afraid of feelings. Like we are. We don't like them. They're inconvenient, right? Like they get in the way of efficiency in a lot of ways, you know. But the problem is like by disavowing them, we really are disavowing part of our humanity, and we lose actually a lot of our dynamic capability as a human being to function within the world, right? So I mean, it's like the constant thing of that 3-year-old kid that's pissed, right? And you as a parent, like, it makes sense. You don't want your kid to be pissed, so you know, don't be mad, don't be mad. It's like, but yeah, but like mad is how the kid's feeling, right? You know, like, and so we go through life sitting there and we learn that. We learn it really, really well. And we're like, oh man, I don't know what it is, but like I just feel like funky around this person. And it makes me depressed. And it's like, I don't know, could you be mad? What would that be like? What would it be like to be mad with this human being? But it's this, it's that over and over and over again, you know. Or I mean, I one of my favorite, you know, theorists that I've really subscribed to, a big part of the reason he was important is because he taught people being sad was okay, you know, that being sad was not an awful thing, you know. Instead, if you think of it as a parent, and it makes sense because the parents day to day, it's not like the parents are doing some awful thing, right? Like it's just the day to day process of, you know, your kid flips out and is super sad, and like of course you're going to try to like restore them to equilibrium. Of course you are. Like, don't be sad, do this other thing instead. So instead of like learning how to tolerate sadness, and for them learning like what sadness is, how to be with sadness, and how to move through it in a way that's actually going to be enforcing of their process of reality, right? We teach them that, hey, if you get the shiny new thing, you don't have to be sad. But the problem is that sadness is always there. You know, it doesn't go away. It doesn't magically, like, it's in there, right? Which then can lead to, again, you know, not to come full circle too much, but like can lead to, again, posture, difference in breathing, right? Like a fear of going into difficult, big, strong affect, right? And a lot of this is, you know, really, really painful for people. I think some of the most severe versions, like if you look at like some of the oldest texts, right? The most severe versions of this were like a conversion disorder, you know, where like thoughts were coming into someone's head, and instead of actually being aware of the automatic thoughts coming into someone's head, their hands stopped working for a long period of time, you know, and they became almost like catatonic, you know. And so that's a very severe, that's probably one of the most severe expressions of that. And I would also offer that psychopathology changes based on the time and culture that we're in, you know, because it always looks different. But that is sort of like the most and the biggest extent of, you know, that process. I mean, if we think about even the earliest soldiers getting treated by Freud, you know, which whatever, Freud, I have a very mixed relationship with Freud, so like I'm not like, yay, he's the best. No, I'm like, yeah, whatever, he missed a lot too, you know. I mean, the biggest thing that he gave us was that he understood that there was a process going on that we weren't aware of, right? And you can look it up online. It's kind of uncanny. The videos of these shell-shocked, aka severe PTSD, now that's how we know it, soldiers that literally cannot walk because they're like wobbling the entire time, because in their mind they're hearing the bombs fall all the time after the First World War, right? But as you go on, like, it's really interesting is like as these soldiers became aware of these processes, and they became aware of the thoughts and the feelings that they were having in a moment to moment basis, and they were aware of these thoughts and feelings in the present, and also aware of what was actually happening in the present, you saw them be able to stop guarding some internal process, and they started to be able to walk normally. It's really incredible. I recommend folks check it out if you really want to see like a severe process of how people are not aware of what's going on with them, but there's that inner process that's taking a toll. That's what I would say.
Yeah, no, I love it. You know, I'm kind of trying to bring it back, not bring it back, but like kind of have physical therapy examples a little bit and trying to integrate it.
Sure.
You know, we kind of met a couple times before this, but you know, you kind of had this nice saying about stuffing your feelings. So like sometimes what I see with individuals, and you know, this could be all of us and myself included, where when I stuff my feelings and I don't get it out, and
Right.
but because I was told not to say my feelings, there's this like block right here.
Right.
So what happens is my throat gets stuffed up, my neck gets tight,
Right.
and you know from there there's this like domino effect to a shoulder that's being weak, and you wonder why.
Sure.
And you know if you actually go deep down into it, you don't have to all the time. Like for me, physical therapy, people come in and that's their entry point. The neck pain is the entry point, shoulder pain is the entry point. But if it's a chronic issue, sometimes, right, there's a deeper reasoning behind it, and sometimes these are the things. And until you're aware of it, it's really hard to change it.
Right. Right. And I think that has to do with being able to tolerate difficult sensation or challenging sensation, or at the very least different sensation, right? And treating it as sensation in a way that you can become curious about, you know, versus that sensation having some, you know, huge overarching meaning in some way. Like, physical pain is a really interesting thing because like we tell ourselves all sorts of automatic stories with physical pain. You know, we really do. It's kind of incredible. I myself included. Like, you know, I'm not like above this or anything. I'm just aware of when it happens most of the time. You know, of like, you know, my shoulder hurts. Oh my God, is it going to be disconnected? Is it going to be is it this is more of a mindfulness idea, right? Like, am I going to dislocate my shoulder? Am I ever going to be able to lift again? It's all going to go away. Life is fleeting. Oh my God, right? You know, like versus like this thing of like, yeah, your shoulder just hurts. Like, what's the sensation like? You know, what's the sensation like in there? You know, and that's a very different idea. You know, that's a very different idea. But again, more on your point, Kento, is like this idea of just this reinforcement of constant. I'll give you a perfect example. I'll disclose a little bit. My parents, whom I do love and are very fun people, very interesting people. Every single time, almost every single time they come to visit, it's like clockwork. I can almost set my watch by it. Like within an hour of them landing, my lower back will start to hurt almost every time. And I'm like, is that something that's like physical? It's like, sure, I'm sure there's something physical going on, but what's the real cause? It's like, well, there's an emotional thing going on there, right? There's something emotional where I'm not feeling entirely like steady in some way. And because I'm not feeling entirely steady in some way, right? I'm holding myself differently. My body is holding itself differently. And then I just keep reinforcing that holding in some way in this different way, which ends up manifesting in back pain. Not to mention that there's an emotional component of I am more aware of potential pain being occurring because they're coming in, and perhaps my cortisol levels have raised slightly in a constant way, you know. And I mean, to those of you who have like fantastic and super healthy and happy parental relationships, I think that's amazing. You know, I think that's wonderful. I think a certain amount of parenting comes with a little bit of, you know, let's just say stress. But you know, that's just my Jitalian sort of thing because I'm half Jewish and half Italian. So you know, it really becomes that process of just like that awareness of like, oh man, oh they're here, you know. And I mean, so that's a perfect personal example. So it's like, so what do I do then, right? So then I think the question is, what do you do when that happens, when that back pain happens? It's like I said, it's almost like something I can set my watch by, right? It's like, well, then I go into it. Then instead of being afraid of it, or like being like, oh, my back's gonna go out again, you know, or oh my God, you know, this is I need to not do anything. Lock it down, lock it down. No, I mean, like that's probably the worst thing I could do, you know. So instead, it's the same idea of psychotherapy. It's like go into it, you know, go into it in a safe way. So you're like your lower back hurts. It's like, okay, it's time to like get in there. You know, let's start working with our hips. You know, let's start seeing if we can get that oblique firing. You know, let's start doing some things as well as let's call out the fact that we're feeling just a little stressed about that visit, right? Let's own that and be able to say that. And I think the next step too, right? Because I think it's a multiple prong process. You know, own it, right? Understand it, and then share it. Be able to share it is probably the biggest, if you really want that next level of, you know, freedom, is being able to say like, when you know mom and dad come through the door the first time, just be like, I'm really happy to see you guys. Frankly though, I'm just a little stressed. I'm a little stressed out that you're here. You know, I really want to have a good time, but man, I'm, you know, it's right. And I mean, I feel pretty comfortable sharing this because I'm sure I'm not the only one that goes through some process of this. Uh, so yeah, that's I think a pretty good example of how they are all like super interrelated. You know?
Yeah, that was great. I'm totally going to use what you said to my parents every time I see them now.
Oh, I love it. I love it. Love you. Little stressed that you're here, right?
No, in a loving way, obviously. You
Absolutely.
know, but yeah, he's like, yeah, just let you know, you being here, seeing my kids, it's kind of stressful. Like, I
Yeah.
bet you're gonna judge me right now.
Right.
So I mean, just by that, my neck is like I can feel it, like my mid back right now, starting to tense right now.
That little
Uh,
bit of awareness of that, of probably both a physical and emotional pattern that got reinforced over, oh, I don't know, 35 years of life, you
you
know?
don't have to tell everyone my age right now, Alex, but it's okay. It's okay. But
20
anyway,
life.
yeah, no, and that was great. And if anyone has more questions during these times, please feel free to keep going and talk about it. So I love the mindfulness aspect of things and being a little bit more aware, especially the part where you said um, when you do feel these things, it's scary for most of us. So actually diving right into it is probably the time that you can actually get to progression. Because what I do sense a lot, and it's no fault to anyone's, but where we might have like a society where it's like, okay, we have pain and we want to take that pain away very very quickly,
Right,
and
right,
especially if it's chronically going. Let's say it's like trauma. Let's say it's like you hit your elbow, you broke, you did something. I get that,
right.
but many times when it's a chronic thing that keeps going and going, many times we're not actually diving into the things that you don't want to feel.
Right.
And when you do that, people actually starts progressing more, is what my experience often with people that I work with chronic pain. We
Yeah.
kind of go through a dip down first, and then we kind of go back up.
It's kind of like that thing of, I mean, not to like be overly solicitous of like Jerry Maguire's movie, right? But it's like that same thing of like breakdown question mark or breakthrough, right? It really is. It's like when someone comes to me and they're having like pretty intensive emotional stress, right? And they're feeling really awful and they're like, things aren't going well, it's not getting better, oh my God, right? Like terrible. It's like, is that a breakdown or is that a breakthrough? Have we broken through this process to another level of understanding ourselves? And I find that is generally the case. When people are throwing up their arms in the air and being like, what the hell? Oh my God, it's so scary, everything's awful. And I'm just like, right, stick with it. Let's be with that, you know? And I think that is a perfect example of that next level of understanding, like, I can survive this, right? Like I am okay in this moment. It's okay to have strong feelings. It's okay to have strong sensations, right? And it doesn't destroy who I am. The fear is that it's going to destroy us in some level, right? The fear is like we're gonna like lose our minds, or we're gonna have a breakdown or whatever, and we're never gonna be able to come back. And it's like, actually, I mean, very very few people, and I've worked with folks that have been incredibly compromised by their mental health in a way that has been that their difficulty in living is so profound, right? And I've seen folks like that. Most folks that we're talking about here, that's not the way that you end up like all of a sudden falling apart. you know it's just not. In fact, it gives you an opportunity to look a lot deeper, and cultivate increased awareness. And I would say that that's true in physical therapy as well. It's the same thing. I mean, it's like the first time you get that hip to pop into place. That is terrifying, man. Oh man, that's scary. Like you're sitting there like, oh, what was that? Oh my God, I'm never gonna be able to walk. And then all of a sudden you start like walking, and you're like, I'll wait, I'm not in pain anymore. And it's like, right, right. You have an awareness now. You have an awareness that you didn't have before, and it's so key. It's so key.
Alex, can you just kind of describe, I know what you're describing about the hip popping part. You know, I know it's you that we talked about. Can you kind of describe can you describe that time a little bit if you don't mind? Because you were just explaining how you felt, and that processing also is, I think it's helpful to everyone. Because
Oh,
all
sure.
when I first had it too, it was like scary, and actually I was with Mike at the time,
Woo.
and like it was very scary. I was like, what just happened to my life is what you feel, not like my hip. It's like, am I gonna be okay?
Right.
And until you can go through that, you just don't. It was a very different world to me. So yeah,
Right.
please.
Right. So I definitely had that process before where, and I'm someone that has had lower back pain issues for a while. However, I have found so much relief in my process. But part of that was, that exercise and the awareness of the hips that I never had before, right? And I can remember even going into the posture of the exercise being like, oh my God, this is dangerous. This is dangerous, right? But in relationship, right? In relationship with someone that is like in my field, it's called the benevolent other, right? The person that is there saying it's okay, right? And we think about attachment too, it's that same thing. It's, if you look at, and they've done all these studies about it, and the mother just being like, it's okay, you can just come to me, it's okay. And the baby will sit there and be like, wait, is it okay? It looks like the mom is telling me so, and then ends up doing some things that a baby would not normally do, and it's the same thing, having a benevolent other in a physical capacity telling me, hey, like, it's okay, I just want you to go, just stay right there, just stay right there, it's okay. And having the, like, that immediate sort of process where all of a sudden you're like, whoa, what was that? Was very different. What is that? That's very, very different. Never felt that before. That's scary. What is that? Oh my God, right? That was my feeling. I was like, whoa, that was really scary. Did that my hip just come out of place? Like, am I going to be able to walk? I don't know what just happened, you know? And then all of a sudden standing up and like the back pain is gone. And I was like, whoa, that is some next. And to the point where I was like, now I'm chasing, I can like chase it, right? Where I'm like, oh, let me find it. Let me see if I can really get in there, right? You know, it's kind of amazing. That's the same thing with therapy. It literally is almost the exact same process. You know, the first time someone allows themselves, and different people will get there at different times, right? And we don't have to judge it, right? But the first time that someone can truly allow themselves to be sad in the presence of a benevolent other, right? The first time that happens, and it's like it's the same thing of like, if I let this in, right, this sadness, if I let this in, then the world, the sky is going to open up and it's going to swoop down and it's going to swallow me, and I'm never, nothing's ever going to be okay, and I'm going to be sad for the rest of my life, right? These ideas of what we're telling ourselves to keep away from it. And the truth is that that doesn't happen. What actually ends up happening is our capacity for joy increases, our capacity for feeling more actualized in the day-to-day realm of existence increases, our capacity to understand our feelings when we're actually having them and in context actually increases, right? But it's that same thing. If I told you, right, if I told anyone like being sad can make you be happy, people look at me like I'm nuts and be like, I don't want to be depressed. And be like, well, it's not the same thing, is it, right? Depression and sadness, you know, commonly misconstrued, you know, like I said, and in our culture now where everything's bigger, better, faster now, you know, sadness is inconvenient. But the problem is that if we don't start opening to this stuff, we end up going through our life not feeling weighted in our experience at all. And we end up weirdly making decisions that are in avoidance versus being head on.
This is, I mean, I'm gonna keep going. This is selfishly for my webinar, I guess. But if anyone has other things, I'm having a couple private chats that I'm not sure if I should read this. But let's go into some of it. I mean,
Sure.
like let's go a little bit more into the current times in quarantine right now, just so it's a little bit more, I'd say, relatable, I guess.
Yeah, sure.
So we're kind of more in isolation. Some of us are with another person more often. Some of us are like stuck with the family more.
Mm-hmm.
So we're seeing more our, let's say, at least proximity, physical proximity around us. We have to be with them for a longer time. And I know you started to do a little bit of YouTube channel
Yeah,
where it talks about what to do during the COVID times.
yeah.
Maybe discuss about, like, you know, when you're, this is also an opportunity, right? So how can you, from your perspective, like make this an opportunity in a sense to grow ourselves and understand ourselves more?
Yeah, I mean, I think it really has been. I think, and it's funny. I've seen a number of my patients have talked about it, and they're like, "Oh my God, I'm doing so well." They're like, "I feel guilty. I feel guilty about it. I feel terrible, like because it's taken this to get to this point where I'm actually feeling like great, you know." And I'm like, okay. I mean, it is a sad circumstance that's happening on the outside, but like, can we celebrate the moment that you're having here in which your awareness has increased, right? But I think some of the biggest stuff, and I mean, I'm a huge I'm a huge consumer of listening to, because it's part of my job, right? Like literature and new research and whatnot, you know. And I think it does afford us with an opportunity, especially if you're in relationship with people that you're close to be able to be very real about where you're at together. You know, I think, and I think there can be a difficulty here, you know, just because in general, um, even though we are partnered and in relationship with folks and we're close in proximity, you know, there is a certain amount of health that comes from having distance from our people. There just is, right? There just is. Esther Perel like talks all about this. She ripped off that idea by from Donald Winnicott, right? But this idea of like space in a relationship, you know, is super important. Well, what do you do when there isn't space? Like when we're limited by our physical space? And I think you just have to be really real with one another in the sense of being able to sit down and say like, and I got a lot of these ideas came from the Happiness Lab, which I think people should check out if they're interested in a podcast. I don't love everything that she posts because I think some of the experts, there's been a few that I'm like, no, but there's a few that are great, right? It was this discussion of really have like like sort of like a meeting, like partner meeting, really talk about it of like, hey, like, what do we do well? Like, what do we do well as a couple? Like, what are we good at? Like, what benefits do we have in this relationship that are strengths that we can come back to time and time again? I think that's huge. I think that's a really big deal because then it can also open up the door to what are we not good at? Like, what don't we do well as a couple? Like, what gets in our way? What happens that somehow like we feel disconnected or frustrated with one another? And I mean, chances are like if you're feeling frustrated with your partner, you're probably feeling disconnected from them on some level, or you're feeling like you're not getting your needs met in some way, right? And so I mean, it's this opportunity to really have these more challenging conversations in a way, while what we really want to do at the same time simultaneously while we're having these difficult conversations is really continuing to hold our partner in high regard, right? It's a weird time and it's a stressful time, and everyone is stressed out. No one knows. There's so much uncertainty right now, and uncertainty makes people weird. It makes people struggle. It's so common. Being able to sit with uncertainty is a skill that honestly needs to be cultivated, over time. And so it's like, can you really have this moment of being like, hey, where are we at? Like, what's up? How can we be better? What do we need to work on? What are we great at, right? How can you do that in a way that still also honors who your partner is, right? It's like dissent. It's the same thing. Being frustrated in a relationship. Sharing that you're frustrated in a relationship is not a bad thing. It's a great thing, in fact, especially if you use it in a way to like help build more connection. Like rupture is not the problem. The problem is people think they're going to rupture and then it's like never going to repair, right? Or they haven't done it for so long that the rupture's so scary and they've been in avoidance of it for so long, right? And it's like, what would happen if you ruptured and then just talked and like talked it out? Because relationships, successful relationships, are not relationships that never fight or never have difficulty. Successful relationships are relationships that own that difficulty, right? Manage to keep their person in esteem, right? And still proactively work on things. Those, you show me that and I'll show you a happy couple. That's how that goes. I think the problem comes, and this is what I would say if we have folks listening, is that if this has been a really long period of time where you have not discussed difficult things in your relationship, I would approach that, because if this is like a 10-year process where you've been holding something in for a real long time, and I'm not just talking about like, oh man, it drives me crazy when your jaw clicks and you eat crackers, right? I'm talking about like, I feel like I've sacrificed X, Y, and Z and like never gotten anything back. Okay, that's okay. And it's important to talk about that stuff. I would talk about that with a third party though. Make sure a third party is there to like help direct. Only because the longer it's gone, the bigger that sort of like gap, and getting some help in staying and keeping equilibrium, because it's already going to be destabilizing for the relationship, and that's okay. It should be on some level, because what we're saying is that stability in this way is actually not that great and isn't working out so well, but destabilizing in a way that is still going to be healthy and helping us grow. Whereas I think if it's only been a little while, or 6 weeks, and your partner, starts just like flipping out because she's like, hey, I need you, I really need you to do that. I seriously, when you don't do the dishes, I feel ignored, right? And it makes me upset. It's like, that's a good conversation to have right now. That's a really good one, or like when I don't know, when we just took this job and bought this house, and now I'm super stressed about it and I don't know what to do with myself, right? And it's like, probably a good conversation to have, probably a good one. But it's like I said, if it's been like a really long period of time, and I'm not generally in the business of giving people advice, but believe it or not, but if it's been a really long period of time, that's when I would say, like, find someone to help mitigate that, because you don't want to open up like some huge thing that's going to be like while you're locked in together. Because actually, the funny thing is, two things sort of happen. Two things demographically shift in times of close proximity, prolonged close proximity, right? Divorce rates go up. That's the first thing, right? And there's a surge of babies being born. That's the second thing, right? It's kind of funny, right? Procreation and splitting up. It's sort of funny. I don't know. I find that funny. Anyway, so what I would say is, like, but it can also be, like I said, it can also be a time to really like start learning to communicate in a much better, much healthier way. And just like we said, if you're guarding about some of that frustration of like, hey, I don't feel like I'm getting my needs met, and it's been feeling like this for a little while, this is a perfect opportunity to bring that up in a constructive way. If you feel strong enough about the communication that you have, and you guys are sort of comfortable with being able to call things out without it being a blame game, and more about how are we doing as a couple, right? The we being the sort of operative noun, in this situation.
Yeah, this is great, Alex. I knew this was going to happen, so we went pretty deep that way, so that's excellent.
Yeah.
I'm gonna try to hold off on my own interest for a little bit. Like, does anyone have kind of like a clinical question, or maybe like this question about the mind-body connection a little bit? Like, does anyone want to jump in? We got about 10 minutes or so, I think.
I know it can be hard to bring this stuff up, man, because it's like, outing myself as being like, super upset all the time or angry. I don't know, it's like, no, probably not. It's like your experience is probably way more human than you think it is, but like I get it. It's hard to talk about this stuff sometimes.
It is. It's definitely not an easy topic to talk about. So like, I totally get it. Um, let's see. Let's see. Does anyone have anything?
Going into like your bag of tricks, like,
I was just
ooh,
looking at my questions that I talked about.
cool.
Uh, yeah, I'm just trying to think a little bit. Because you already kind of gave a little bit of advice as well, like when you talk about these things. And my thoughts is like how we relate to not just to our bodies, but to other individuals also does matter. I really like the advice you made, where if it's a big rupture, do have a third person, because there's a good chance that you both of you do not have the the structure to help each other out. So you actually need another person to give you that reference almost in
Right,
order to help that out. Just like
right.
people come into physical therapy, like for example, for me, I'll try to help my spouse, right? It never works, by the way. It never works for me, at least.
Well,
Um,
the kid's in the way. Don't worry, you don't have to disclose that. I'm just like,
no, that's all good. It's all good. So I
in
usually
this,
have
in this
another person help me.
always being asked for a massage. It's just like, oh my God, get away. I don't want to touch you. Leave me alone. Like,
Yeah. So but it's probably because there's something about when it comes to this like therapeutic patient relationship, there's something that I'm missing with my wife.
sure,
Not, and I don't take it personally, and so I asked another person, and someone else has something in there that I don't currently have, or she doesn't feel safe, she feels safe about, to
right,
help that out.
right, right.
So it actually really helps, and just understanding that actually gets me one step closer to treating. Like I'll
Right.
have moments nowadays where I'll just, by the way, wifey, I love you very much. I have moments of it where I can treat her.
Right.
And it's a really good sign for us because we'll talk about difficult emotions regarding that. We'll be like, hey, like I feel like you don't want me to treat you, and
Mhm.
she's like, that's not it. It's more like how I project certain things. So that's really helpful.
And that thing of like neither of you are wrong, right? It's that thing of like this is just my experience, and it's like can that be recognized of like I can see that that's your experience, and I'm empathetic towards that, and vice versa coming at you, and it's like that thing. I think specifically in couples work, it's that idea of like we get wrapped up in this idea of like who's right, who's wrong. That's not really how it goes, right? I mean, because there's two people in a relationship, so it's more this is where I'm at, where are you at, and really being able to take that in a way that's helpful, and that's a very different thing because I think it it's a paradigm shift, right? It's like that idea of like there's not a right party, wrong party. There's just different experiences.
Alex, I don't mean to kind of cut myself off here, but we have someone in the chat. Can you read that? Just go. Do you know how to get to the chat part?
Sure, exciting.
I think it's a great question, actually.
I'm scared. Yeah. Oh no. Okay. Yeah. Yeah. And I mean, that's such a great question. Should I read it out loud, or is that helpful? Or
Uh, Depends on. I mean, she kind of did
I,
it more public. Yeah.
yeah. Okay. Okay. So it said I have, and I'm not going to disclose who the person is, but I have shooting pains in my hands, and I am scared because of childhood abuse. Right. And I am currently in EMDR therapy, and have gotten far, but still seem to have the shooting pains when I'm startled or scared. Right. What steps can I take to decouple this unconscious reaction other than the therapy I'm doing? I think that's such a powerful question, and I want to thank the person for sharing that question because it's very brave, to share something like that. So that's a really amazing thing and a testament to your strength already of where you're at. So I would say that the issue comes in where we want to like disown, right? Like, and it's this thing of I want to disown it, and it seems like uh, some sort of like childhood trauma and the association towards pain and shooting pain, right, is pretty deeply ingrained right now. And I would say the biggest thing that's going to be the biggest help for you at this point, and is really going to be that when it happens, we don't want to try to disown it. It would be normal or natural to want to disown it. Like that would be normal. You would want to be rid of it and just be done with it. And that's completely understandable. And at the same time, it's really not about like disowning or disavowing from the experience, unfortunately, which is probably not what you want to hear. And I'm sorry to say. It's more of like, can you hold a sense of self-compassion for the process and the experience that you go through when it does happen? Like, can you really allow yourself, to almost speak to yourself very gently and with gratitude and appreciation, in those moments, versus that type of like, I just want it to be like, I want to take it from here or take it from here and put it away someplace else. It's like, I don't know. It could happen eventually. Most of my understanding is that it wouldn't, only because it's really affiliated with, a neurological connection that's been reinforced pretty strongly, pretty strongly. So I would say that the path towards healing this is one that you've started clearly already. And I would say that the continuing layers and levels of this are going to really be about slowing down when the experience happens, being with the experience in kind of like a really radical way of, being able to be there. And I mean, I'm a huge believer in um, these practices, or like mindfulness based like heart meditations or whatnot. And in this case, it would still be something that would work. It would function in the same way, as long as you're not feeling traumatized while you're doing the exercise, but really stopping, when it happens, touching the places where it hurts, allowing the sensation to be there, letting it happen and saying, it's okay, this is allowed to happen, right? And then from there, being able to offer yourself words of gratitude and appreciation, something along the lines of, I see you, or I'm with you, or I'm here, it wasn't your fault, or it wasn't my fault, right? All of these words that can really sort of begin to change the connection of that experience. That's what I would say. But it unfortunately, it is one of those things that in my experience is going to it is going to be there for a little while, and it's just the more gentle you are with it, the faster it's going to go. I love this phrase because I think it's so accurate, but this idea of slow down to get where you need to go as fast as you can. I think that's pretty powerful stuff. It's pretty powerful stuff. So thank you so much for the question. Thank you. That's a good question.
Yeah, thank you, Alex. And thank you for the question. We're kind of getting up to the 1 hour mark. Is there anyone have another question that they want to ask? Yeah, that was great. Alex, so much for the thank you so much for coming to the webinar. I really appreciate it. I hope some others kind of got a different taste, not just kind of neck pain, not just low back pain, but just different worlds, how they kind of work together. Because I believe it really is helpful. It's not that like everything that I work with is going to go into this direction all the time, but sometimes it does. Sometimes it does. So kind of understanding that is, I think it's very useful, or at least for some of us that might hit that, can be useful at times.
I hope so. And it was a pleasure to be here with you all. And it was just great. I love being able to I love being able to talk about this stuff. I mean, honestly, I became a therapist because I thought it was so fascinating. I was like, oh, man, this stuff is so cool. So any chance I get to like geek out, I'm like, oh, this is great.
Yeah, for all of you, like this was our first time kind of having a guest speaker. And Alex, thank you for being the first person.
Yeah.
So if anyone can give me like a constructive criticism, how we could kind of like conduct it better. Because from the way I feel it right now, like we're going to continue this beyond the quarantine. So I hope to have more guest speakers. I've already had a couple people we talked to that we're going to do guest speakers. One maybe in this webinar already right now. But anyway, but yeah, thank you so much, guys. Thank you for coming. We are gonna, if I'm being honest, we are gonna take a quick break when it comes to educational webinar next week. When it comes to it, we're actually gonna do it more towards patients. So if you're still interested, come on over. But we're gonna be more towards more like low back patients. So just an FYI. But in 2 weeks from now, we're gonna come back. Just watch out for our emails.
Yeah, very cool. Very cool. Well, thank you so much for listening, folks, and I hope everyone does as well as possible in this, like, in the bizarro land that is the now, and we hope that everyone stays healthy.
Thanks for watching this video. If you found that helpful, and if you now are thinking that I wonder what else this person can help me with, please go to our website at www.kamiyamapt.com and find other free contents, or apply to our free discovery visits to further see if we can help you. For any further information, please email us at info@kamiyamapt.com. Thank you so much.